So, prevention of breast health. I mean, some of the things, thermography is a tool, ultrasound, it can be a tool, especially if there's a certain area or something's failed a density, a certain area. You can look with the ultrasound when you're focusing on a certain area, or ask the doctor for ultrasound, particularly if the breasts are dense, fibrosis and dense, you could ask for ultrasound, which is sound waves and not radiation. We want to avoid hormone disruptors that we've talked about in the past, and even a lot of soy, especially GMO soy or non-fermented soy, all the pesticides and the glyphosates and all that, and balanced our hormones naturally. Sometimes we use natural progesterone. Sometimes we do herbal things. Iodine, therapeutic iodine, and iodide is very good for the breast. It's taken up by the breast, ovaries, uterus, and prostate, so it can be helpful. Lymphatic massage or exercises where you raise your arms over your head and pump those lymphatics under our arm, help prevent stagnation of lymphatics in our in the breast area that back up in the breast. Of course, healthy diet and nutrition, which we recommend all the time. So we want to look at those focal changes. Sometimes it could be inflamed, congested lymph node. It could be a tumor or something of nature. We want to look at those things. And this is an example what ductal carcinoma in situ, sometimes they call it DCIS, where when they do a biopsy, the cells, abnormal cells, it's only confined to the cells, so it hasn't gotten out of the cells to be a true cancer, but many doctors treat it as so. But obviously we need to be aggressive to prevent anything from developing. And this is more of a fibrocystic breast changes before and after. And this is, some people do thermographies on animals, so we'll call this a CAT scan. But there are veterinarians that use thermography as a screening tool. So the human mind is like a parachute. It's of no use unless we open our minds. So look for these tools that can help us stay healthy that we may not hear about in traditional traditional medicine. Thank you.
Great. Thank you very much. Great presentation and some great questions. Someone asked about thermography with dental health. Do you see much of that with thermography with dental health?
We do screen the head and neck area, and we do look at the dental area for asymmetries, inflammation, TMJ shows up, and but yes, a lot of times I may see some asymmetrical warmth, or sometimes it's just general warmth. Maybe they have a lot of periodontal gum disease. And so, yes, with the head and neck, we do screen for some dental inflammation. It's not necessarily pinpointing the exact tooth, but we can get a region that we're concerned about.
Gotcha. So this thermography is every 3 months, depending on the findings, and you see patients and you read a lot of outside scans. So you gave us one example, the lady with progressive disease. Are you ever consulted to help with an intervention? I'm not saying you were reading these serial events, but maybe you see patients, you see, okay, 3 months is getting hotter, 3 months getting hotter, et cetera. What are you ever brought into consultation? You're just simply reading and what's been some of your experience with some of these imaging you've seen?
Well, a lot of the patients that go for thermography have a holistic practitioner that they go to, and usually are more holistic minded, so they may have a practitioner. When I read reports, I usually have comments, and I like to include things to make people think about or talk to their practitioner about things they can do to improve, because I don't like to just take pictures and watch things get worse. Love to see them get better. So things like iodine, of course, vitamin D is very helpful in prevention of a lot of cancer and chronic disease. And, being mindful of checking the hormones and hormone balancing and making sure we're estrogen dominance, we're not supporting that with our diet and lifestyle and fried foods and a lot of, chemicals and things we're exposed to. But occasionally I've had someone that wanted to get a consultation, but usually my consultations are more comprehensive and we do blood work, etc. I usually want people to talk to their practitioner and to go to someone that can actually do a breast exam and to monitor their breast and and order ultrasound, etc. if they need to.
For healthcare practitioners who may see this either live or on recording, who may be interested in this technology, is it very cost prohibitive or very costly to have a thermogram? And of course, they probably send it to someone like yourself to read it. But tell us about the technology and expense for like a healthcare practitioner who may want to use this.
Oh, you're saying if a practitioner wants to do thermography in their office? Is that what you're saying? Or refer them out?
Do them in the office. Let's say they want to buy the thermometer and do them on their patient, and then send the readings out to be images out to be read.
Yes, there are thermal imaging cameras that can be purchased, and I guess it depends on what you call expensive. I think when we started, I think it may have been around 25,000, 30,000. Would you say, Dr. Floyd? I'm trying to remember, to get a camera.
You can remember. Okay. Yeah, most camera technologies run anywhere from 20. It used to be 20 to 30,000. I would say around 30,000 because of the technology. They have the new HD cameras that are very more defined. You can actually see better and sharper images, so you're able to define a little bit more of the screening. But yes, the purchasing the technology is probably the most expensive part. That includes buying the software and the camera. But if you are really proactive with it, it definitely can pay for itself based on patient population. I think people will be surprised at the number of people these days who are aware of it. When we started back around 2005, not many people were aware of it. I think in Houston, we were one of the first offices that had a stationary thermography center in our office. There were some other companies that did mobile thermographers out of other cities that would come to Houston for the doctor's office to do screening. But that was the number one thing. Another thing is getting the images read. You want to go to a certified or a thermologist, which is like a radiologist that can read thermograms, to be able to get your screens read, so you have information to go on. And I guess Dr. Pamela can speak on that because she's been doing that. But the readings actually give a practitioner more information to go on to determine where to start and evaluate the patient, because sometimes patients come in with these diffuse set of symptoms, but they don't know. It's hard to find out where to start. What's the most important area, and a lot of times thermography will reveal those areas.
Wow. Excellent technology for this day and age when you want to try to, get early detection. And it's also like the fact that you can pick up on musculoskeletal injuries and defects early to get some information in terms of what's going on. Because oftentimes, and I can actually present this as a question: do some practitioners often use thermography to direct other imaging? So maybe someone has some soreness or pain or some practitioners getting thermography first and looking for hot spots and then determining what imaging study to do after that? Or how does that work?
Well, unfortunately, most conventional doctors are not exposed to thermography, and so they're not familiar with the reports and not as comfortable with this. So they will rarely refer patients unless they've been enlightened and see. I mean, occasionally I run across a OBGYN that is aware of thermographies, and when a patient declines mammogram or doesn't want to initially do a mammogram, but says, I'll do a thermography, and if there's some concern, I'll do a mammogram. Some will go with it if the patient is informed and makes an informed decision, and the doctor just documents that they have declined mammogram at this time, but want to do it. But thermography doesn't prevent one from having a mammogram. I have many people that do both. But we know that mammogram is radiation. So I think that's why we don't want to expose women too early. So they wait till they're at least 40, to 50 or so to start the mammogram, because cumulative radiation can contribute to cancer. So I've read like a book that said, in years to come, they may say, why were we radiating ourselves to prevent cancer? But the mammogram is the gold standard for screening, and so I can never say not to do a mammogram. It's a personal decision. But some people say I won't get a mammogram, but don't do anything prevention, wellness, nutrition wise. Just don't get a mammogram. And that's sort of like having a loaded gun. If you just say you just won't do anything for screening. So we have to be mindful of that.
Yeah, you have to be strategic. I like that idea of maybe using this, early on to decrease the number of imaging. Just for everybody who's listening, if you haven't had a chance, hit the thumbs up button. Also subscribe if you hadn't had a chance to do so, and hit the notification button. You'll get information about upcoming talks. Also, you join a subscription group. You can also look at previous presentations we've had. And of course, share this with any friends, anyone who may benefit from this lecture and this valuable information. Now, here's an important question from Jackie regarding uterine biopsy or uterine disorders. Can thermography be used to evaluate conditions of uterine disease, inflammation in the uterus?
Thermography can show some inflammation, usually in the lower pelvic area or sometimes towards the back with uterine fibroids, but it doesn't take the place of a biopsy. When they're doing a biopsy, they want to make sure there's no risk for uterine cancer. If on ultrasound that the endometrial lining is thickened, we want to make sure there's no spot of cancer. So it doesn't take the place. I mean, many times you have to think about it. If we have uterine fibroids or thickened uterus or heavy bleeding or fibrocystic dense breast, we've had some negative, personal habits, diet and exposures to chemicals and things like that. So Rome wasn't built in a day. It takes time to counteract that. So if there is a thickening of the uterus of concern, and the doctor advises a biopsy, I think one should get that. But in the process, do make the changes in your diet. Definitely go organic and go more plant-based and get the chemicals out and the smoked foods and the fried foods and things like that can be carcinogenic.
This question you've answered. How often should someone get the thermography test done? I think it's every 3 months, depending on the findings. But the wife.
Well, not necessarily every 3 months, but usually the first is first, and then for breast, usually I recommend repeating it 3 months to get a baseline and comparison, making sure there's no progression. And depending on how it looks, if it's significant, maybe in 6 months, but if it's more of a concern, maybe 3 months. But if it looks pretty stable, eventually we'd say annually, unless someone has symptoms. So, and then other parts of the body, this is breast, but other parts of the body could be annually, unless there's a concern in that area and we want to look at that sooner.
Bone health, osteoporosis and osteopenia. What can it help us with that?
Well, definitely inflammation of the spine, and many times with osteopenia, there's pain and inflammation and risk for fractures, compression fractures, which are mild, which are not serious, but they can be painful. So it usually does show inflammation. So, but if we have osteopenia, osteoporosis, we, in addition to screening, we need to be proactive with the things to better build our bones. And I'm not a one for a lot of calcium. I think we should get our natural calcium like the cows do, with a lot of dark greens. And we should alkalize. Many times when people have osteopenia, osteoporosis, it's a lot of chronic acidic nature on your body and acidic pH. So alkalizing can help. And, also weight-bearing exercises. And there are some supplements that help. I'm not a proponent for the osteoporosis type medications, because many of them have a very long half-life that, the half-life may be as long as 7 years, meaning if you stop taking it, it takes 7 years for half of it to be out of your body. And the bone that it produces is not always a healthy bone. But so I think lifestyle and diet is very important with the osteoporosis, osteopenia.
Yeah, it's very, very important. Wow, that's impressive information, very valuable information, impressive presentation, Dr. Atkins. Any final words or final comments for our audience in terms of, just using this technology or any technology in terms of prevention and staying on top of their health?
Yeah, I think you want to, if you go for thermography, you want to know, have an idea who the thermologist that reads it. Some thermologists that read thermographies are chiropractors, or maybe have less clinical experience with breast health and things like that, and don't always include comments to things that can be helpful to things to think about nutrition wise and lifestyle wise. They read it, but so I try to include some comments when I read mine. And I did see some questions about iodine. I think iodine is very important in prevention of breast cancer, and sometimes you will read about it therapeutically helping not just breast but ovaries, uterus, prostate, but can be very helpful and supportive of the thyroid. But you have to go to a practitioner to get a therapeutic dose and to monitor you and making sure you use it correctly.
Wow, fascinating. Yeah, there were a lot of comments on iodine. I showed a few of them. Some were suggesting some therapy, so I'm glad you commented on that. Well, thank you very much, Dr. Atkins. This was a very impressive presentation. And as usual, I learned a lot, especially with the screening aspects of it in areas other than breast disease. And so I think there's a broad spectrum of use for this, and hopefully more physicians will start to adopt this therapy, because, it's certainly painless. I mean, the cost of technology is somewhat steep, but I think once you have it as a modality, I think that cash prices are not too bad. Many patients pay that amount of money and more with insurance for the typical imaging study. So, you may end up paying a few $100 going to get an MRI or CT scan, oftentimes with insurance. And so, this can be done in an outpatient setting. There's, less hassle going to an imaging center or hospital, deal with paperwork and all of that stuff. And so people have to take those things into consideration. The more you can do in a more simple, straightforward way, I think the better. And we try to apply similar modalities in our center. So this is very important for people to understand, and hopefully more people, certainly on the medical practitioner side, will adopt it, but also on the medical consumer side, hopefully people will start to demand, imaging studies like this and seek it out. Because I think, basically just, go online, do a digital search and find a, thermography imaging center near you. And so I think that's something that's very important. So thanks again, and I will see you two guys backstage as we close out. As usual, I learned a lot, and I think all of you will learn a lot. And as I said before, hit the thumbs up button, like and share. Please share this with loved ones, anyone who can benefit from this information. We will be back on next week, back live, and we have an exciting show for you next week. We are working on a documentary, and I'll be telling you more about that later. So we're working on a docuseries that's going to be about natural health interventions. And so we'll have some more information about that probably within the next couple of weeks. So stay tuned. I'll also be posting some things online to share with you to get the message out. But until next time, keep it fresh, natural, and live.